Well, one of the newest emerging trends in the battle against cancer is using your body's own immune system to fight disease. Immunotherapy is recognized as the most promising new cancer treatment approach since the development of the first chemotherapy 70 years ago. Although single immunotherapies are showing great promise, researchers are finding that combining immunotherapies with other treatments can help patients worldwide who aren't responding to one treatment alone. Here and now, with the latest developments in this new field of cancer treatment, is Punit Dhillon, co-founder and CEO of OncoSec Medical, to discuss how this therapy is changing the future of cancer care. Thank you for joining me today.
Hey, thank you for having me on your show.
Now, first off, how does immunotherapy help the body fight cancer?
So what we're talking about when we say cancer immunotherapy, we're harnessing the innate power of the immune system to fight cancer. You can think of it, we know these conventional therapies like chemotherapy and radiation, they don't work because they don't treat all of the disease. Where cancer immunotherapy is effective is actually it's treating the underlying disease, it's activating the immune system, you're getting a broad response in the body, you're getting the immune cells to recognize and train what cancer cells look like, so they have this memory response well beyond when the treatment is applied, and you can continue hopefully having these patients in remission. So a much more broader response is what we're talking about with immunotherapy.
Now, are there different types of immunotherapies, or is it where one fits all?
No, there's many different types of immunotherapy because there's many different components that go into looking at cancer immunity. And some of the classes of therapies that have had a lot of traction or success here that we've seen is cancer T cells therapies. We have cancer vaccines, checkpoint inhibitors, small molecules. And I think it's worth spending just a few seconds on what checkpoint inhibitors are and what promise they have. We've seen this class of immunotherapy is actually getting the most attention because it works across a whole range of different cancers. They've already been approved in several cancers. And one high-profile case that you might remember is this case of President Jimmy Carter, who was treated with a checkpoint inhibitor for melanoma. So they work very well, but they only work in the minority of patients, and there's a lot of work to be done there.
This does sound promising. Now, tell us more about the new research that's showing that promise when immunotherapies are used in combination with other treatments.
Yeah, that's definitely where the field is going. The combination of basis approaches is where we need to get, where they have the most power and impact. And you see some national attention there with programs like Vice President Joe Biden's program on Cancer Moonshot 2020, which is actually focused on combination-based approaches. The combination-based approaches are relevant because you're trying to find synergy between two different approaches or more that actually help to improve the response rates for patients. And there, companies like OncoSec and our technology, Immunopulse IL-12, can have the answer to recruit these necessary fighting immune cells, these T cells that are necessary to actually make a difference for these patients and actually kill the cancer. With single therapies alone, like checkpoint inhibitors, some patients don't have the necessary soldiers there to actually kill the cancer. And we've demonstrated in recent data in melanoma that when you combine with Immunopulse IL-12 and you prime the immune system and you have a checkpoint inhibitor given after that therapy, that we're improving the response rate up to 75% in patients with melanoma. So that's a great outcome compared to single therapy activity alone of just 30 to 40%.
Yes, absolutely. Now, with these advancements and the progress that you've made and have shown that it's working, are you now starting to see the healthcare industry respond? Is cancer care starting to shift away from traditional treatments and towards immunotherapy?
Absolutely. So they're definitely seeing a huge shift moving towards cancer immunotherapies, especially we're going to see in the next 10 years probably the majority of cancers being treated with cancer immunotherapy, and rightfully so, because you know that these cancer immunotherapies are probably the fastest moving segment. they're powerful, they're having longer responses, they're having limited side effects compared to well-established therapies. Those well-established therapies, they work when you can reach all of the cancer, but if you leave some cancer behind, then there's a chance for recurrence. But they're not very selective. They're actually treating the healthy cells and the cancer cells. And when you're exposing the healthy cells to drugs, you have a potential for side effects. Whereas with immunotherapy, it's highly targeted, highly selective, highly personalized, and you're getting a much more broader immune response.
And lastly, can you tell us where people who are more interested in cancer immunotherapy can find more information?
Yes, you can find more information at oncosec.com. That's our company website, oncosec.com, as well as if you want to find more broader information on cancer research, you can find it at cancerresearch.org.
Great, thank you so very much. And again, for more information on cancer immunotherapy and the latest advancements, visit www.oncosec.com. Thank you so much. It's been a pleasure.
Great. Thank you very much.
Have a wonderful day.
Bye-bye.